Welcome to Maryland Medicine Frontline News, highlighting faculty, staff, and students who are fighting COVID-19 on the front lines of research and clinical care. Coming up, COVID-19 puts a spotlight on the problem of health disparities.
These populations will be affected often first and sometimes often worst.
But first, a clinical trial testing the safety and efficacy of a new COVID-19 vaccine candidate has entered an important new stage. Researchers at the Center for Vaccine Development and Global Health are now including those at greatest risk, people between the ages of 65 and 85. Cynthia Sikorsky is among the older volunteers who are receiving 2 injections 1 month apart.
As a healthy adult, I fall into the 65 to 85-year-old cohort, and I felt that there are so many people in that demographic who have suffered enormously, that I felt that it would be something that I could contribute to, a small but significant step to developing a vaccine against this dreadful virus.
The older participants will receive an experimental RNA-based COVID-19 vaccine candidate developed by Pfizer and BioNTech.
So this vaccine, this mRNA vaccine that was the first to be tested in the US, made it into humans in record time. It was about 9 to 10 weeks from when we had the sequence of the virus, depending on how you count. So we're moving at record speed.
Sikorsky's son Michael, an MD PhD student at the School of Medicine, participated in the trial early on as part of the younger cohort.
I am extremely proud to be a part of this study and also to be a member of this university community. I feel that their goal to improve the human condition is exemplified at all levels, particularly in a study like this, which will have sweeping impact against this pandemic.
Older people are not the only group at high risk. When it comes to COVID-19, disparities also exist in racial and ethnic groups.
If you look at diagnosis of COVID cases, the current data indicates that about 28% of our cases are in our African American population. So not a big difference between the representation in the state as a whole and the population and the number of cases that we're seeing. But interestingly, we see that African American, the fatality rate is actually quite a bit higher than that. So about 40% of the deaths are in our African American community. In our Hispanic population, we see that they actually get diagnosed at a considerably higher rate than their representation in the population. So the state of Maryland has about 10% Hispanic population. And the case data is that they represent about 27% of our cases. So almost 3 times what their representation in the population is.
The reasons for these disparities can be complex.
At a simple level, people focus on, African Americans sometimes tend to have more comorbidities than other types of groups: diabetes, obesity, hypertension, so on and so forth. And clearly some of those diseases seem to put you at greater risk of poor outcome when it comes to COVID-19. But the reality is we really need to be looking earlier in the process at, why is it the case that African Americans or Hispanics or any group, what is the reason that explains why any group would have overrepresentation for any kind of disorder, disease, and so on and so forth. And I think, those are very much about poverty and economics and violence and communities. And I think some of what we see playing out at the same time with the protests is a growing awareness of issues of structural racism and how that plays out for people in real time in terms of how they interact with police, how they get access to health care, how they take care of themselves.
We should recognize that there are disparities in health access. There are disparities in health care. There are disparities in health outcomes. So essentially, we have to look at it in a comprehensive manner to ensure that all peoples within a population are either have access to testing, as in our pandemic, or access to clinical trials. We need to renew our commitment to those types of efforts, where we recognize these communities and we make a purposeful effort to address those issues. Because what happens if we don't? When there are pandemics or just disasters or emergent infections, these populations will be affected often first and sometimes often worst.
In next week's Frontline News, we will focus exclusively on COVID-19 research by the Institute of Human Virology, under the leadership of IHV co-founder and director Dr. Robert Gallo. You can stay up to date by visiting the Coronavirus Update page on the School of Medicine website. Until next week, I'm Larry Roberts for the University of Maryland School of Medicine.